Good morning, everyone. On behalf of the University of Buffalo, it's my pleasure to welcome you to the beautiful home of the Jacobs School of Medicine and Biomedical Sciences and beautiful Buffalo. We are very fortunate that the weather cooperated, and so we're thankful for that. As Alumni Week continues, we thank you for joining us for the Harrington Lecture and weekend honoring our distinguished alumni and reunion classes. I'm Lori Luzzi, president of the Alumni Association and the graduating class of 1988, and we have celebrated our 35th reunion this weekend. Had a great time last night. I hope all that participated had a great time, and we look forward to the rest of the weekend. So today's program is filled with exciting elements. In a few minutes, we will hear from our keynote speaker, Dr. Helene Gayle, who will be interviewed by Dr. Bashir and share more about her career and thoughts of the future of healthcare. We will then introduce this year's distinguished alumni and formally conclude with tours and class reunion activities. Before beginning, I would like to welcome and acknowledge several groups and several guests here with us today. Thank you to our UB leadership, Dr. Satish Tripathi, and the schools and university partners who played a role in today's program. A warm welcome to the many alumni who are in town from over 26 states celebrating a reunion, especially our Golden alumni and class of 1973, who are celebrating 50 years or more since graduation, quite a feat, and the reunion committee for making today's activities possible. Congratulations on achieving this milestone. Don't forget there will be a shuttle waiting for you after today's lecture to take you to lunch on South Campus. I would like to acknowledge Dr. Gayle's cousin, Dr. Kenneth Gayles, who is celebrating his 50th reunion and was last year's Alumni President's Distinguished Award recipient. We want to thank Dr. Gayle Bernstein, Dr. Maxine Hayes, and our students who will be assisting us in today's program. We also welcome our alumni and families who will be honored in today's program. Our Distinguished Alumni Award recipients are Dr. Myron Glick, celebrating his 30th reunion, Dr. Claire Frazier, who was unfortunately unable to travel due to surgery, and Dr. Jonathan Daniels, who will be honored with the Alumni's President Award posthumously today. Jonathan's wife, Janessa, is here today to accept this award. I am now pleased to introduce Dr. Allison Bashir, UB's Vice President for Health Sciences and Dean of the Jacobs School, a highly accomplished neurologist and leader in academic medicine. She is a powerful advocate for promoting everyone in all facets of medicine and medical education. Welcome, Dr. Bashir.
So thank you, Lori, for that wonderful introduction. And I just want to say good morning and welcome to our school, to the students, the alumni, the donors, fellow deans, the staff, the family, and our honored guests. It is so exciting to welcome you to the Harrington Lecture and to our beautiful state-of-the-art building. I hope everyone got a tour here this morning. I want to welcome our alumni back. And I also want to point out that we have more than 70 Golden alumni with us today. That's the class of 1973. Amazing. We are so glad that you came here to see all that is going on in Buffalo. I know that you've been sharing your fond memories, your aspirations for the future of the Jacobs School. Over the last month, we celebrated the graduation of the students from the biomedical sciences, our MDs. We had more than 300 students walk across the stage. Our vast network of alumni are out in the community. They are across the country. They are here in Buffalo, and they are all helping to make care better for patients. They're advancing research, and they are working collaboratively with their communities. I'm proud to say that of the 175 medical students, many of them have chosen to stay in Buffalo, and we hope that the ones who are training elsewhere will come back to Buffalo. I know from moving here that all roads lead to Buffalo. So I also want to welcome back all the UB graduates, and it's my goal to really meet the challenges of research, clinical care, education, and live into the mission of our commitment to our community. We are one of the oldest medical schools in the country, and we're the oldest college at the university. The schools of health, many of the deans here are participating in UB's historic hiring, and our goal is to develop a long-range strategy and to become one of the top 25 public research universities in the nation. We want to double the amount of research awards in the Jacobs School over the next 5 years, and we'll be trying to increase federal funding, but also expanding clinical trials and bringing research to our community. We're moving in the right direction. I'm pleased to say that we've had a 20% increase in NIH funding from fiscal year 21, according to Blue Ridge, which is an independent ranking institution. And lastly, I really want to reiterate our commitment to the community. The Jacobs School is here in downtown Buffalo. It is our goal to address the health disparities and work through all of our missions. What we want to do here at our medical school is to improve health of Western New York. So it's my pleasure now to welcome UB's 15th president, Satish K. Tripathi. He's an accomplished researcher, transformative higher education leader, and the firstborn international president in the university's history. Welcome, President Tripathi.
Thank you, Alison, and good morning, everyone. On behalf of the entire university at Buffalo community, it is my pleasure to welcome you to today's Harrington Lecture and Distinguished Alumni Award Ceremony. Before I begin, I want to acknowledge one of my bosses is here, Suni Trustee Eunice Lewin is here. Suni, welcome. Along with all of you, I'm very excited and looking forward to today's lecture by our distinguished guest, President Helene Gayle, an internationally recognized expert on health and humanitarian issues, and now the 11th president of Spelman College. Dr. Gayle has dedicated a great deal of her remarkable career to health equity and social justice. I was sitting with her and talking last night during the dinner, and her worldwide knowledge about health and health equity and her work in underserving countries, regions of those countries, and I talked about India. She had spent a lot of time in India in the regions that really are underserved, and thank you for the work that you have done worldwide. As many of you know, Dr. Gayle was most recently back in Buffalo last month to reflect with community as we mark 1 year since the racist massacre at Top Supermarket. Again, I was telling her last night that this was probably the best panel that I have really seen. The participation from the panelists and especially the moderator was one of the best, actually. Her insight and thoughtful perspectives were so important to our weekend of remembrance, healing, and hope. And we are privileged to welcome her to UB this weekend to discuss issues and resonate deeply with our mission as a premier public research university committed to serving the greater good. Indeed, we have made it our institutional priority to address injustice and to build a healthier, more vibrant region and world. As we thoughtfully advance towards a more just society, we are harnessing our expertise across disciplines, including prominently in the Jacobs School of Medicine and Biomedical Sciences. Central to UB's commitment to our work with the community to connect research that benefits those who have been marginalized and disfranchised. UB initiatives like our Community Health Equity Research Institute play a key role in our efforts. This program is a partnership of UB faculty and community stakeholders dedicated to advancing our understanding of the root causes of health disparities and creating solutions. In many ways, our clinical faculty and researchers in Jacobs School and across our health sciences schools are contributing to the health, well-being, and vibrancy of Buffalo and our Western New York community every day. Through our disciplinary expertise, we are keenly positioned to confront the issue of race-based health disparity within underserved communities. As we continue this critical work, we are honored and excited to have President Gayle with us today. A Buffalo native and a Bennett High School graduate who told me that also she came to UB for many functions and activities while she was in high school. Dr. Gayle attended Barnard College before earning her medical degree from the University of Pennsylvania, as well as master's degree from Johns Hopkins. An accomplished scholar, she has authored numerous articles on global and domestic public health issues, poverty alleviation, gender equity, and wealth inequity. Throughout her impactful career, she has advocated for the right to access health care, addressing barriers to health equity, and other pressing humanitarian issues. President Gayle's professional role has included Assistant Surgeon General and Rear Admiral to the Commissioned Corps of U.S. Public Health Service, Chair of the Presidential Advisory Council on HIV/AIDS during the Obama administration, Director of Programs for CDC and Bill and Melinda Gates Foundation, and President and CEO of CARE, one of the world's leading humanitarian organizations. She's also served as consultant for World Health Organization, UNICEF, and the World Bank. The former president and CEO of Chicago Community Trust, one of the nation's oldest and largest community foundations, Dr. Gayle rejoined academia when she began serving as the 11th president of Spelman College in 2022. She's a member of the American Academy of Arts and Sciences, the National Academy of Medicine, the Council of Foreign Relations, the American Public Health Association, the National Medical Association, American Academy of Pediatrics, and many other organizations, too long to say in 10 minutes. Among her many recognitions, Dr. Gayle was awarded Chicago Mayor's Medal of Honor for her work on COVID relief and recovery for the city, was named one of the Forbes 100 Most Powerful Women. And not the least, in 2016, the University at Buffalo had a great honor of conferring a SUNY honorary degree in science upon Dr. Gayle in recognition of her meaningful achievement and contributions to society. With that, it is my privilege and pleasure to introduce today's distinguished guest, President Helene Gayle.
Dr. Gayle, welcome back to Buffalo. We are so pleased to have you here today, and thank you for joining me in this conversation. You've had just such an amazing career in the private sector, the nonprofit sector, medical, world health. Can you tell us a little bit about how you chose to go into public health and what was some of the things that drove that decision?
Sure, and I would just like to say how wonderful it is to be back in Buffalo and to be with friends and family. This is definitely a great homecoming, so thanks so much for inviting me. You know, I guess I would say, for me, I always knew that I wanted to have a career where I could have an impact and address some of the urgent issues of equity and inequality around here as well as around the world. I happened to go to a school that had a very strong pre-med program, and that got me thinking about medicine. I will say, early on in life, my cousin Kenny used to. He was always going to be a doctor. He was downstairs in the basement cutting up animals and doing his anatomy class and everything. And we just thought, at least I thought, like, okay, that's what you have to be. If you're going to be a doctor, you got to start doing this very, very early in life. So I really hadn't thought about medicine per se until I, did get the encouragement when I went to Barnard, and they have a very strong pre-med program. Along the way, I started getting some notions about public health. We really didn't at Penn. There wasn't a public health school at the time, but I happened to go to my younger brother's college commencement, and the speaker was D.A. Henderson, who was the man who co-led the smallpox eradication campaign. And it gave me this idea of public health and what you can accomplish and how you can do something so tremendous, like wipe off the face of the earth a disease that had, really had such a devastating impact around the world. And so I started getting more and more interested in this notion that, while you could take care of individuals as a clinician, or you could take care of populations and have an even broader impact. So I got kind of started down the track of public health, did my master's in public health while I was in medical school, went on, finished my clinical studies in pediatrics, and then went to the Centers for Disease Control because I figured I'd done my full clinical training, let me get some more practical public health training. Went to the CDC for a 2-year training program, thought I would stay for 2 years and stayed for 20. I stayed because CDC was a fascinating place to learn public health and gave me a really broad background in a variety of different things. My very first supervisor, Jim Marks, who's also celebrating his 50th, is here today. And it was people like Jim Marks and others who embodied what it meant to be a public health professional. And so I had a wide range of experiences, but also right around the time that I was going to CDC was when the HIV pandemic was really starting to unfold. And although I didn't initially start in HIV, I became drawn to HIV because for me, it was not only this very fascinating, interesting new disease, but it was really clear early on that it did impact populations that were marginalized and populations that otherwise faced unequal status within our society. And so for me, because this issue of equity and social justice was such an important part of my why, if you will, HIV in some ways gave me the opportunity to focus on a very important public health disease, but one that also was linked to other societal factors as well, those that we now call the social determinants of health. And how do you think about the things that put people at greatest risk for poor health, not just because of access to health and health services, but the broader context in which one's life plays out. So, from working on HIV, I was then recruited to the Gates Foundation at a time when they had said global health was going to be their highest priority, and that HIV was going to, among all of their priorities, be the highest. I ended up being recruited by the former director of CDC, who was a mentor for mine, who was the other person who co-led the smallpox eradication campaign, Bill Melinda. So, everything is kind of always this mix between preparation, luck, and circumstances, as well as your networks and the people that you know. And so I think that it was a wonderful opportunity to go to the Gates Foundation when it was first starting. At that time, all of global health could fit around one table. Now they have 1,000 people on that team, about 2,000 at the foundation overall. And then that led me next at doing a lot of work in the global arena. That then led me to my next position at CARE, where we focused on eradicating global poverty, and particularly with a focus on empowering girls and women, because we know what it means if you can make a difference in the life of a girl and a woman, how that creates a virtuous cycle for the family overall. So that was 100 countries around the world, and lots of great experiences. We'll talk about some later. And then finally, before coming to Spelman, I worked at the Community Foundation at a time where I really felt, having committed so much of my time to global work, that there were a lot of issues here in this country that needed to be addressed. And so focused on closing the racial and ethnic wealth gap and really looking at what does it take at a community level to change the wealth inequity that we see, and particularly related to inequities in race and racial and ethnic communities of color. So that's kind of a round the world of how did you get from point A to point B. And then, Spelman, when they called, wonderful institution, it was hard to say no and feel like I could be contributing the things that I had to the next generation of young women who wanted to change the world.
Oh, thank you. Thank you. So you mentioned impact, and I know you talked to several of our medical students earlier today. What advice would you give for all of the students here that hear about your path? What advice would you give them?
Well, we talked about it a little bit today, and again, if anybody had told me when I was in medical school that I would end up being the president of a college and doing all these other things in between, I would never have predicted it. And so, I always feel, and I tell students, know what your why is, know what it is that makes you feel like you come alive, what's your passion, what is it, where's your North Star, and stick with that. And don't be wedded to any one path, because you never know what's going to come your way. And sometimes if you're too rigidly focused on it has to be step 1, step 2, step 3, you're going to miss some of the opportunities that really give you the chance to stretch, to grow, and to think differently about your career. So mine has not been a linear path, but I've been happy to be able to continue to use my skills in a way that I hope makes impact and has made a difference.
Well, thank you. Thank you for that. I want to talk a little bit about some of the challenges in medicine, particularly having black males enter medical school. So I know the statistics, but 3.1% in 1978, the number of black males that entered medical school in the country. Today, it's less than 2.9%. I want to get your opinion about how we can get more black males to go to medical school, and what we as leaders in the community and nationally can do.
First, I was happy in talking to the students to see that Buffalo, in fact, is doing a pretty good job of recruiting underrepresented minorities. So congratulations on that. I guess first and foremost, it is thinking early on in the pipeline. If you're just presenting the possibility of a medical career when somebody is already in college, it's too late. And I think working with communities early on and making sure that, particularly for young black men, that they see black men who are also in the medical field, so that they see somebody who they can relate to, who can be a role model. So I think it's the intentionality and making sure that you're thinking as early as possible, exposing people to medical careers. And at CDC, we had several schools that were kind of pipeline schools where we exposed young people to careers in public health. And that was in elementary school. And so that's when it needs to start, is really early on. And again, I think the importance of mentors and role models can't be underestimated.
Great, thank you. You were recently here for the May 14th Remembrance, and as President Tripathi said, it was a powerful session. I wanted to ask you to reflect a little bit on how medicine can deal with the epidemic of gun violence.
Well, I think by working with communities and really working directly with communities, so often our medical schools are islands within their community and their neighborhoods, and I think University of Buffalo has been one that has really tried to be much more community oriented. And so I think thinking about these broader issues, education, access to incomes and wealth, all of these things that can make safe, having safe neighborhoods, all of the things that, again, kind of the social determinants of health. How are we thinking about the way in which people live their lives and the possibilities of having a sense of hope and opportunities? We know that we have a huge potential to opportunity mismatch in this country. And so we've got to do more to make sure that our bright young people are getting the kinds of opportunities so that they want to do something with their lives, so that they have a sense of hope and a sense of hopefulness, a sense of future, and wanting to have, wanting to live for the future. So I think all of those things are critical. I also happen to think that we could do more in terms of legislation for gun control. I think there's a lot more that we need to be doing on the policy and advocacy angle if we want to really have safety in our community. So, I think it's all of those things.
Okay, thank you. I wanted to turn now to some of the challenges of debt with medical school, and the University of Buffalo has worked with the Association of Medical Schools of New York and our state legislatures to get more funding for medical students. We have a variety of pathway programs, as you described. We also have the Jonathan D. Daniels, MD, 1998, and Family Memorial Fund to honor our beloved Dr. Daniels and his tireless campaign to diversify medicine. What do you think we can do as communities, nationally, locally, to make medical school less expensive and more welcoming to a broader group of students?
Yeah. Well, first, I think, and this is not just medical school, but higher education overall, we really have to start thinking about the cost of higher education and what can we do to make education overall more affordable. And at Spelman, we've looked at alternative revenue sources so that, in fact, we can hold our tuition costs down as we develop other sources of revenue. One of the ways, that I think institutions can do it, and I think of University of Pennsylvania and all that they did for the surrounding community. They totally changed West Philadelphia from when I was there to what it looks like today. And that includes ways in which they now also have revenue as a result of some of the economic development that they've had in the neighborhood. So I think all schools should be thinking about how can we bring down the cost of our school. But we also need more scholarships. And I'm so pleased to hear about the kinds of scholarships that you have here, some of them that include students staying in the Western New York area so that they can have an impact on the health outcomes here. So I think there's a lot of different ways to do it, but the formula is not hard. The actual formula is not hard. It's just doing it. One, make it more affordable, and two, making sure that we have more opportunities for students who do need financial support through scholarships and other programs.
Great, thank you so much. And I would be remiss if I didn't thank our community for their support. There has been an outpouring of support for scholarships for our students, and a real drive to have scholarships that will keep people practicing medicine in Western New York. That's one of the goals of the school, is to have an impact, as you've said. If we could talk just a little bit about a number of the issues that Buffalo's East Side neighborhoods have had challenges. You've reflected a little bit on the social determinants of health. How can medical schools really engage in dealing with some of those issues and teaching students and others that I think, you met Dr. Reverend Pointer earlier, and we're so appreciative of all the work that everybody in the community has done in helping our medical students. Could you just talk a little bit more about the social determinants of health?
Yeah, so the social determinants of health are, how you live, work, and play, if you will. Do you have safety in your neighborhoods? Do you have high quality education? Do you have access to nutritious food? Do you have access to a living income? All of these sorts of things that are so critical so that your basic life needs are taken care of. And all of these are the things that we know contribute to the health disparities that we see. And we put a lot of focus on access to health and health services, which is great, and we should, and that's fundamental. But we know that health, a larger portion of your health is actually determined by social determinants of health. So we need to put more focus on those, and I think that we have not incentivized enough to think about those issues as much as we focus on health and access to health. So I do think that a school that is such an important anchor institution can be an important part of, if nothing else, engaging with the communities, providing information, being a resource to communities beyond only the health services, but to actually be a big anchor institution that engages directly with community.
And housing's a big issue too.
And housing, huge.
People who grow up
Huge.
in housing,
Right.
Issues with asthma, lead paint, et cetera. As a pediatrician, I know that's really near and dear to your heart.
Yeah, and just housing instability alone is a huge cause of poor health.
So you grew up in Buffalo. And we would love to hear, as you know, we're growing. I mentioned that earlier and in our discussions. We'd love to hear you reflect on how we can recruit more people to Buffalo and help us tell the great story about how amazing Buffalo is.
Well, you could do something about those winters.
Well, the winters are a bit milder, except for this one day around Christmas.
Well, I think first of all, Buffalo is a great city. And, when I left Buffalo was really on the decline. And I think over the last couple of decades, Buffalo has really started moving in the right direction, population starting to come back. The cost of living in Buffalo is great, and there are few places left in the nation where you can, buy a good home at a price that is affordable for many. There's no traffic jams here. Moving back to Atlanta, I've had to readjust to how difficult it is just to get to point A to point B. I mean, I can, if I have a flight here in Buffalo and it's, at noon, I can leave at 11 and know for sure that I am going to get, and I'm not going to be running. I mean, there's so many things about the quality of life here that I think is incredible and people don't realize. I think the friendliness of people from Buffalo, the neighborliness of people from Buffalo. And so, while Buffalo obviously has its challenges and it is still a deeply divided city in many ways, it is, it's a lifestyle that I think many people could appreciate. And, coats, buy a warm coat in winter's fine.
So I will also say, though, it is absolutely gorgeous outside and will be
beautiful.
gorgeous here for many, many months. And I agree with you as a relatively newcomer here, Buffalo has been so welcoming, and it is really a community that comes together during the good times and some of the very hard times we've had over the last year.
It also has a nice waterfront, it has now developed the waterfront, and there's lots of lakes that you can go to. So there's lots to be said.
Yeah, well, we're so appreciative that you're here and will help us go back and tell everybody about our amazing school and the amazing community. I did have one more question, and since we have a lot of different people from backgrounds, in public health and being a federal official and in your role, how can we help champion all the things that we've talked about in terms of policy development?
Well, first of all, for me as a public health person, I want more people to understand how important public health is. We rightfully so put a lot of resources into developing new cures, new medicines, and that's fabulous. And I think, in this era of artificial intelligence, we're going to be able to speed up the discovery process in ways that I think will be tremendous, and I think we will continue to have breakthroughs. And we saw it during COVID, the fact that within a year we had a vaccine when, traditionally it takes decades to do vaccine development. But I also think that we underfund public health. And if I look back to the COVID pandemic, and people are rightfully so critical about some of the ways in which CDC did not play its role as effectively as possible, a lot of that is because it's chronically underfunded. When SARS came, and even when HIV came, the budgets go up, and then when the crisis is over, the budget is cut. The public health workforce is cut. Our ability to have good surveillance and laboratory, all of those things. So I think, if I were to say what I would love people to advocate for is remember that how important public health is, and remember that you can't do a good job of controlling a pandemic if you're under-resourced. And so that would be one thing. And in general, I think that we don't use our voice as citizens as much as I think we could. And when I was at CARE, we had an advocacy program where we had people volunteer and go to Capitol Hill on a regular basis to be able to talk to their congresspeople about bills that we thought were important for the work that we were doing at the time. And I will never forget going into these meetings with everyday citizens who would talk to their congresspeople, and I could have stood on my head and done cartwheels, and they wouldn't have listened to me in the same way, because that's my job. But when they see the people who vote for them and put them in office coming and talking to them about these issues, the power is tremendous. So I just think all of us could do more as everyday citizens to use our voice and make it known for the issues that we care about, because we do a lot of complaining, but we don't always do enough action.
Thank you. And I'd be remiss if I didn't point out Dean Wachowski-Wendy here, who is our Dean of Public Health, and it's amazing school and has been in the community for many, many years doing exactly that. Your point about advocacy is terrific, and I think we have a community that is really committed to that. We have some questions from the audience. Okay. So you mentioned Dr. Marks, and I just wanted to introduce Dr. Marks. Dr. Marks is a 1973 alumnus of UB, and he's the former executive vice president for the Robert Wood Johnson Foundation and a former colleague of Helene's at the CDC. Dr. Marks?
Thank you. And thank you both, Helene and Dean Brashear. I would have to say that where I was going to go with my questions, you've really answered, because it's the development from medicine to social determinants that has, I think, been one of the major changes over the last couple of decades. And the fact that more and more medicine is seeing how important social factors like housing, education, and safe neighborhoods are for health overall. Your career has really been a remarkable one as a leader in HIV/AIDS, global health, humanitarian aid, and in the Chicago Trust, where you changed its focus to one of health equity and the reduction of income inequality. I was going to ask you about that transition, but you've answered it so well in your own thinking. I would like to ask you, how do you think you as a leader have grown over the years and and how that can help students and faculty think about their future and their future leadership roles? Your last point about policy, I thought, was really important, because policy is the scaffolding a society uses to build what it wants to become. You don't need to change policy if you're already there. And so I thought that was a crucial one, and that's a crucial one for leaders, but it's also how do you foster young and have people develop. So I'd like you, I know that this is not the question that you heard I might ask, but it's the one, you've done all of that so well. I would like to have you talk about that one.
Great, thanks. And it's also wonderful to see Judy Marks here too. When we were starting out, we ate a lot of meals at your house, and you're always so great in terms of welcoming all of us young EIS officers. I guess when I think about how to develop skills as a leader, ultimately, I think one of the best skills of a leader is listening. And I think for career in general is being willing to listen and learn from those around you, because I think it takes you a long way. I think, generally, and I said it earlier, I think it is being open to new opportunities that has been, for me, what has kind of defined my career. Being willing to take things that might be seen as a bit of a risk, not necessarily staying in the prescribed path, and thinking about, how you continue to broaden your skill set so that whatever job you go to, you're bringing a broader range of skills. Because I think really, what leaders often do well is that they synthesize a lot of information so that you can move forward. So I think that ability to continue to get a range of different skills and continuing to sometimes do things that are a little bit off the regular track but give you some broader, stretches you more, I think is a lot of what I would say.
Great, thank you. So we have another question from Reverend Kaiser Pointer. He's the pastor of Liberty Missionary Baptist Church, and he is a beloved instructor here at the Jacob School.
President Tripathi, Trustee Lewin, Dr. Bashir, President Gayle, my UB family, community family, friends, good morning. Good morning.
Good morning.
Preachers need you to talk back. President Gayle, first of all, thank you for not counting it robbery to come back home and give of yourself to us here in your native Buffalo. Thank you so much. So my question, considering the intersection of health equity and social justice, how would you advise us in the UB community to plan an expansion of the kind of engagement that UB and the community together can have that will impact Buffalo's East Side?
Yeah, your question in some ways answers your own question, in that, for me, I think the only way to be relevant to community is by really having that kind of engagement. And I think for far too long, large institutions have assumed that they have the answers and set up programs and different opportunities, but not with community input. And I just feel it is so critical that before we come in with our programs, that we are actually talking to a range of community and not necessarily assuming that we have the answer, and making sure that we are getting deep enough into the community as well to really understand and see things from their perspectives. And I think that with that, then with the right resources and the right capabilities, one can do incredible things.
So, speaking of community, the next question's from Dr. Gayle Bernstein. Dr. Bernstein is a 1990 MD graduate. She has an MPH. She's an alumni, and she is the Erie County Commissioner of Health.
Okay.
Thank you. I'm also a CDC expat.
Oh, great.
So,
And a pediatrician.
and a
Okay.
pediatrician, yeah. Helene, given that many of Erie County's poor health outcomes are really driven by the social determinants of health, like poverty, poor housing, education, as you had identified, can you please share with us some lessons that you've learned from your vast international experiences that we could try to apply here in Erie County to improve our health outcomes?
Yeah, I think breaking down boxes and silos. So, and it's sometimes hard to do because we're funded in boxes and silos. So the housing program gets its funding from separate funding than the medical program does, different than the education program does, et cetera. But I think that there are ways of breaking down silos and working across different departments. And without doing that, I think it gets really hard because you're a health department. You're not a housing department. But there is a housing department who you can find ways to work together. Some of the programs that I thought were the most impactful that we funded when I was in Chicago were the ones that we had one called Housing Plus that was really all about health in the context of providing affordable housing. And so we worked the health department, we funded the health department to work directly with the housing department to develop this plan. And so I think that the more you can look for ways that bring you together and allow you to have this kind of integrated programming, the better. Always with some tangible, concrete goals in mind, because when we do this amorphous, let's collaborate, nothing happens. But when you say, we're going to look at a particular health outcome, and we're going to work with the housing department and the education department, and we're all going to figure out what's our piece of that pie, put that together, and develop a program, then I think you can really have something that can make a difference.
Thank you.
Thank you very much. So our next question is from Mariah Martindale. You met her earlier. She's the class of 2026, and she's the current president of the Student National Medical Association.
Thank you, Dean Brashear, for the introduction, and thank you again for spending your morning with us, Dr. Gayle. So my question for you is, what advice would you give to a young woman, and even more so a young woman of color, navigating the medical field in the public health sector?
Great, and when we were talking backstage, I had mentioned to the students I was SNMA president, national president, when I was back in medical school. It's actually where I met my husband, so I have fond memories of SNMA. I don't know if I would give any one specific advice. I think it is always important to be well prepared. I think it's important to have a great network and that's why I think SNMA is so important, because you will have tough times. You will have times where you feel like you're being underestimated, or where you feel like being a woman of color is somehow not valued. And so I think it is important that you have colleagues and cohorts like SNMA and other groups that you can go back to and get fortified and strengthened. But I think more than anything is believing in yourself and surrounding yourself with people who believe in you as well, because obviously you can do it, but you've got to make sure that you keep that belief, and you also surround yourself with people who continue to tell you that it is possible. And find role models and mentors and people who you can go to when you're feeling, when you're feeling discouraged, or like you don't know if you can believe in yourself. So. those are some things.
So we have one more question from the audience, and then one final after that. So the next question is from Maxine Hayes. Dr. Hayes is a 1973 graduate of UB. She's a distinguished alumni and a Spelman graduate, and also nationally recognized for maternal and child health expert. She's the former state health officer for Washington State Department of Health. Dr. Hayes?
Thank you for that introduction. Being here, Helene, you are the reason that I came this far across from the Northwest, Pacific Northwest, to this meeting. You were the draw. And I just want to thank you for your service, but more than that, now that you're at Spelman College, and you have access to some of the most talented in our community, you'll be able to tell them so many stories of your story. And that is encouraging itself. Now, the question that I have for you, you've answered pretty much many of those points that were made earlier. But I want to draw a special attention to something that really has gotten my attention. The director at CDC made it very clear that racism may be or is one of the biggest threats that we have to our health. And when people hear that, they don't immediately get it. And I think it's time for a new narrative on health. And I'm very careful about using health as opposed to health care. Because our attention and our resources and our money and our investment, a lot goes into the care. But the issues that are really long-term never get at the root of the problem. And the root is social policy. Health is really social policy. And it comes in many forms. We have to get to the root causes. We won't make it. So I'm very curious as to what have you thought about in terms of actionable things that we can do. And I think the first one is to really have a narrative on health. The American people don't get that. And most of our communities don't get that because the focus is disease. 20 years ago, 50 years ago, it's always was disease focused. But health and well-being should be part of the narrative. And why we have a lot of evidence that we can use that. The future of public health and the future of the public's health. The National Academy has already done a lot of the work, but we need to create an atmosphere where the narrative of prevention and health promotion is louder than the care message.
Mm-hmm. Yeah, thank you for that, and it's wonderful to see you, and I think of my time in Seattle and all the wonderful things you did for the state of Washington. And there's a lot in what you said, so let me just, a couple of things. You know, I think it was really important when the CDC director did make the declaration that racism is a public health emergency and a real crisis. And I think all the things that you talked about are part of the reason. So we know that, you know, if we look at the history of race in America, it's very clear that many of the social determinants of health that we've talked about are you know, a challenge for people of color and communities of color here, whether it's housing, education, access to food, public safety, et cetera. And there are more programs now that are actually looking at taking a social determinants of health model. As an example, Rush University in Chicago put together what they call this program, West Side United. And the west side of Chicago is one of the poorest sections of Chicago, and there is a 30-year life expectancy gap between wealthy parts of Chicago and parts on the west side of Chicago. And what they did was to say, we're going to focus on education, on public safety, nutrition, and jobs, and use those as how we're going to get to decreasing the life expectancy gap by 50% over, I forgot if it was 5 years. So they explicitly, healthcare, but then all of those other 4 aspects were, and they have already demonstrated by using a social determinants of health model that they are starting to see a closing of that gap. So I think particularly important, and you know, because of the history of race in America, by definition, more likely communities of color. But we also have come to see that racism in and of itself and the stress of racism has a independent impact on health that we're just starting to understand more and more about that. And so I think that obviously attacking racism is challenging. It's rooted in our systems. It's rooted in so many things and has been so long-standing. But I think we also have to start thinking about, if we want to improve health, how do we also start attacking the issue and the systems of racism that exist? And I think if we do that, we'll not only make a difference in health, but we'll also have a healthier country.
So our last question is from Jamal Williams. Jamal is a 2020 UB graduate with his PhD here in the Jacobs School, and he is also an assistant professor in the Department of Psychiatry.
Hi, Dr. Gayle. So my question is, so growing up here in Buffalo and on the east side of Buffalo, I understand the family dynamics and community dynamics that exist, and also how information is disseminated from pillars in our community. So how can we as a medical school empower everyday people to be involved in advocating for health inequities that affect us the most?
Well, you know, I think I know that there are many, many wonderful organizations here in Buffalo that are community organizations that are led by people of color, and I think working with organizations that are grassroots and in the community, know the community, and developing alliances with those organizations is at least one way. And I think oftentimes, you know, community-based organizations don't have all the capacity that they need to be as effective as they could. So are there ways in which people could help to increase their ability to have an impact, you know, and develop those kinds of links? You know, sometimes it's as simple as having the CFO of the hospital work with them on good budgeting. Sometimes it's helping them raise resources. But I think forming those kinds of alliances and helping to build the capacity of organizations that serve the community directly is one way of doing that.
Okay. So we have one more question, but I want to thank all of our yes, ma'am.
There's a health sciences charter school over here, which is trying to build a pipeline to get doctors in our community. I've been volunteering there for the last 10 years. And we have a young doctors club there, and we are really trying to get a pipeline. We have one school who become a doctor from veterinary medical school. They're looking for mentors. It's a fantastic school right in the medical campus. And if anybody can mentor over here, mentors.
In the school that you're working with is the name of it?
It's Health Sciences Charter School, and it is right on, right in that area on Main and Hampton. It's walking distance from here.
Right.
And we've had a bunch of programs. We take them out to see a lot of different things. Global Vascular Institute, we went there. And we take them on field trips. And we have little things for them. It is doing a fantastic job. We would love to have students go to UB. That's our goal.
Great.
And it is right here, and we are doing it.
So we have one more question here for you. If you had one wish for Buffalo, what would that be?
Oh, one wish for Buffalo besides warm winters.
I'm going to fix that snow, I promise.
I guess Buffalo has always been a friendly city where people care about each other. And even though there have been some horrendous situations like what happened at TOPS last year and other things, and there's both a real warmth in the city, but there's also a lot of divisions in the city. And so, I would love to see Buffalo continue to come together more and more as a unified community so that everybody has the ability to feel that warmth that is so much a part of Buffalo, and that everyone has the opportunity to realize their full potential. And so I think Buffalo is a work in progress. And I think that, sometimes very difficult situations are what helps to bring communities together. So my hope is that Buffalo continues to pull together as a community and that it can be a national model of what it means to have a community where everyone feels like they get what they need to be ultimately happy and successful.
Thank you. I want to thank you for answering all of our questions. I want to thank everyone. And now my partner here is back up on the stage.
Thank you.
Thank you, Helene, Gayle, Maxine, and our students for your thoughtful questions and contributions to our discussion. Before we begin our Distinguished Awards ceremony, I'd like to invite Allison to join me at the podium, which she has already done. So together, we can thank you, Helene, for your willingness to participate in today's program and return to Buffalo for the second time this weekend. As our token of appreciation, we present you with this gift.
And it's a buffalo.
As the president of the Medical Alumni Association, it's my honor to recognize past president of the Medical Alumni Association, Dr. Jonathan Daniels, class of 1998, who would have been celebrating his 25th year reunion this year. Dr. Daniels, unfortunately, passed away a year ago in a tragic fire, and many of us, including our board, wanted to acknowledge his impact in perpetuity. Dr. Daniels was a wonderful colleague, physician, and beloved member of the school. I had the honor of serving on the admissions committee and the Alumni Association with Jonathan. He was a powerful force for good on many levels for our school and our community, and is sorely missed. We invite his wife, Janessa Daniels, to accept this award on behalf of your family. This plaque will also be added to our school near the medical alumni classroom. This year, over $200,000 has been raised in support of the Jonathan Daniels Scholarship. His legacy lives on, and his scholarship will help support the need to make medical education more affordable and more diverse. It will also help us to recruit scholars from underrepresented communities and serve our local pediatric community.
Thank you, Dr. Luzzi. Now it's my pleasure to present our next award to Dr. Myron Glick, class of 1993. With this award, we honor his distinguished career as a model physician, a grassroots activist, an exemplary mentor, and a great humanitarian. His work as the founder and the chief medical officer of Jericho Road Community Health Center has had a profound impact on the Buffalo community. He's been providing care for all and supporting the Buffalo's refugee community. The commitment and dedication that's led to the expansion of Jericho Road Health Center to 5 healthcare locations at Buffalo also offers community access to dental care, a pharmacy, and a gym. It's amazing. Beyond Western New York, he also provides access to quality care throughout the world, including Sierra Leone, the Democratic Republic of the Congo, and Nepal. For all that he does globally and locally, we should offer compassionate care to everyone. We are absolutely honored to recognize Dr. Glick as our 2023 Distinguished Medical Alumnus. So Claire Frazier, PhD, 81 distinguished biomedical alumni, could not attend today. But I'm pleased to acknowledge that she, in the class of 1981, is the 2023 Distinguished Biomedical Alumnus. With this award, we recognize her groundbreaking accomplishments as a global leader, a visionary in the fields of genomic medicine, microbiology, and immunology. But before we go, I also want to thank Dr. Luzzi for her tremendous service to the Alumni Association, and we have a special gift for you too. No, and Jen kept it hidden under the podium. Thank you for everything. We are so So I want to just close with first thanking everyone who is here today. The whole auditorium is full. Those of you watching on Zoom, Dr. Luzzi, Dr. Martz, Reverend Pointer, Dr. Bernstein, Maura, Dr. Williams, Dr. Hayes, and Dr. Glick. If you could all come up here and join us for more photos. And I also want to welcome you to come and say hello and thank you to Dr. Gayle before she exits for her next event. I think I recall talking about tours. We have more tour guides waiting in the atrium just outside our lecture hall, and they can take you on a tour of our beautiful school. One of your alumnus, too, Dr. Steve Turkovich, also, where is he? Somewhere around here. He volunteered to take people over to see the beautiful Oshai Children's Hospital. And so we just are so thrilled to partner with Dr. Turkovich and all of our healthcare partners around the community. So with that, I wanted to call the session to a close, but please come up for photos and please come say hello to Dr. Gayle. I know she'd be thrilled to see you. And I want to thank her again for a really profound discussion this morning about how all of us can have an impact in everything we do. Thank you. Kind of got the crossing. I should have sat here.